are disproportionately impacted by maternal mortality rates in the U.S. Even when they have income, even when they have education, they still may not receive equal care just because of the color of their skin.
It's unfortunately very shocking. People that look like me need this. They need the support, they need the awareness. Happy baby, happy parent, happy mother.
At Pampers, our purpose has long been about caring for the health and happiness of babies at every life stage. It's our role as a brand who's supporting parents through their journey to really step up and drive awareness of this and drive action towards change.
The way that the work kind of shook out, we wanted to tackle two different areas. The first was healthcare literacy. We learned that a lot of Black women actually aren't aware that this is an issue, and they're not aware of the questions that they might need to ask or the things to look for. And so partnering with the Queen Collective and helping to push a film that drove education around the issue and working with the influencers to also spread awareness.
There are so many people that don't talk about this, but seeing a commercial like that show up raises an avenue for us to discuss things that we may not commonly just talk over cocktails.
And then the other area that was very near and dear to my heart is on the system side. So one of the things that we were able to do in the spring of last year was to work with the March of Dimes. We were able to train 800 healthcare professionals on implicit bias.
And we're seeing great receptivity when we do this of individuals in the hospital system that are wanting to make a big change.
I have two wonderful boys, and hopefully one day my kids and their kids will not have to deal with such or hear such statistics.
Every woman should have the opportunity for equal access to high-quality health care.
Making sure that we're keeping this issue top of mind, we know that it exists, is going to take partnership across all levels
of governments, corporations, and communities.
And for Procter & Gamble to continue to take stands, it makes me feel proud.
The power of an equal chance.
The power of an equal chance.
The power of an equal chance.
Hello, good afternoon, everybody. It is a pleasure seeing you all today. My name is Vanessa Sherris. I am a brand director on the Pampers brand, and I am very happy to be here with a fantastic panel and a room full of amazing people, change makers and advocates to talk about a very critical issue, Black maternal health. And so we have two goals for our time today. One, if you're someone who is just getting familiar with this issue, our hope for you is that you will leave here more informed and then therefore more motivated to find a place to do work in the space. And our second hope is if you're someone who's already doing work, already intimately familiar with this issue, we hope that you leave here connected and feeling reinvigorated, inspired to continue doing the work that you're doing. And so in the video that we just watched, you saw a little bit about the work that Pampers has been doing in this space, focus on using our voice and our reach to drive awareness, developing resources and disseminating it to both providers and parents, and then also really working on trying to help with systemic issues. And sorry, I have to turn back here. I can't forget about you guys. Really focused on trying to help with the systemic issues, partnering with the March of Dimes to help there. And so, you know, we've started doing a lot of this work, but we know the maternal health crisis is a huge issue. And the disparities that Black moms face are not new, right? And so although this could be very disheartening, I, for one, have been very, very inspired by the fantastic work that I've seen from individuals, 3 of which are on the stage with us today, and organizations that are really working hard to support Black moms and try to improve health outcomes. And so with the work that's been happening in the community, I am also very proud that Pampers has decided to make a commitment to continue doing that work. I think it's very important for corporations to be involved. And so we are committed to continue continue to drive awareness, and not just to drive awareness, but to motivate people to take action. And also really committed to helping with the systemic issues. And so one of the things that we had made a declaration to do is to double the number of maternal health care workers we're helping to train with bias training, but then also partnering with organizations doing work on the ground to improve health outcomes and continuing to do that. And so that's just a little bit about Pampers. I know you guys don't want to hear me talk about Pampers for 30 minutes. And so I am going to start off by introducing our wonderful panelists. And so I'm going to start with Miss Ashley Wisdom. Ashley is the founder of Health in Her Hue. Health in Her Hue connects Black women and women of color to culturally sensitive healthcare providers, evidence-based healthcare content, and community support. She is also a Vital Voices Leadership Incubator Fellow. Welcome, Ashley. And next we have Miss Angelina Spicer. Angelina is a comedian and actress on a mission. Using her social media platform, she is an outspoken advocate for maternal mental health after she was admitted into a psychiatric facility for treatment of postpartum depression. It was then that her journey to remove the stigma from shame and guilt associated with PPD began. Thank you for being here, Angelina.
Thank you for having me. Yes. Everybody say, hey, TikTok.
Hey, TikTok! And finally, we are very thrilled to have Dr. Terry Major Kincaid. Dr. Terry is a double board-certified neonatologist and pediatrician who specializes in the care for premature infants and their families. She is an expert in neonatal palliative care, racial health disparities around birth and maternal health outcomes, and an expert in follow-up of high-risk infants and physician-parent communications. Welcome, Dr. Terry.
Hey, everybody.
So thank you all for being here. You guys saw in the video the statistic that's been grounding a lot of our work, that Black women are 3 times more likely to die from pregnancy-related complications than white women. And not only that, that America in general is having a maternal health crisis. We have the highest maternal mortality rates among developed nations. And the issues with Black women, the disparity of Black women, have only gotten worse since the pandemic began. I think recent CDC data says that maternal mortality for Black women has increased 26% since the beginning of the pandemic. And so this has been a pressing issue and continues to be. And so we're going to unpack that a bit with some questions. But first, I'd like to start by giving our panelists about a minute to just talk about your story connected to this, talk about your connection with Black maternal health. And we can start with you, Dr. Terry.
Anybody who's ever met me knows that I cannot talk for only a minute. I'll try. Y'all got a timer in the audience. So, as she mentioned, I'm a neonatologist and a pediatrician. I've wanted to be a neonatologist since I was 4 years old. I love holding humans in my hand and watching them go home. But whenever someone's admitted to the neonatal ICU, I wonder what we could have done differently. And when I was in medical school, that's where I learned that Black women, even with a college degree, were 2 times more likely to have a birth outcome, that SES status is not protective. And I was horrified, So I love being in the NICU. But my goal is for nobody to ever have to come to the NICU, and maybe I can retire and do something else. My sister was a preemie born in 1968. I always say she was the first preemie that I ever cared for. So she inspires me every day and that legacy. But what brought me to this space was that we should not be in the richest country in the world and have outcomes like this. I should not feel like I have to move to Denmark, which is #1, by the way, right now, to survive my pregnancy or have my baby survive the first year of life. And that's why I'm here. I think that was over a minute, but I think y'all get the drift.
Thank you. Hi, everyone. I'm Angelina Spicer. I am a stand-up comedian. I'm also what I call an accidental activist. I planned to get pregnant. I planned to be a mother, but I did not plan to have postpartum depression. I didn't plan to be 1 in 5 women diagnosed with postpartum depression, nor did I plan to be the one of 3 in 5 Black women diagnosed with postpartum depression. I was, like I said, I had a husband, I'm educated, I graduated cum laude from Howard University. Bison all day, yes. Sorry, that's how we call and respond. But I graduated from Howard. I planned my life. I planned who I was going to have a child with. I planned like most middle-class people do. It wasn't by accident. It wasn't a mistake. And my pregnancy was fine until I was marked high risk at 30 weeks. I was diagnosed with IUGR, infant growth. My daughter was growth restricted. Okay, her head wasn't growing, but the legs were. And I was like, what is this? My baby got a small head but long legs. What does that even mean? No one broke it down. No one explained. The only thing the doctor said to me was that we need to monitor you for the next 8 weeks, and you have to come in twice a week, or your baby will die. And he walked away. He did a moonwalk out the room. And I was like, how do you just drop that bomb on someone and not ask, do you need any more support? Do you need guidance? Do you need more information? Do you need more education? What can we do to support you in these next 8 weeks to have a successful outcome? It wasn't until later that I realized that that's when my that's when the anxiety began for me. Then I had my daughter. I carried her successfully 38 weeks, 5 days, and I was so thankful. And the postpartum, just the shock of motherhood kicked in right away. And then my doctor's down there sewing me up like a pair of pants, and I'm like, what is this? And then we got home and it got worse. I was not sleeping, my breasts were leaking, spraying the walls, and I was like, this can't be life. And then the anxiety kicked in. Is she breathing? Am I gonna drop her as I'm walking down the stairs? Is a goat gonna come in the door and lick my daughter's face and then drink my breast milk? Like, what is this? Right? What nobody tells you. No one tells you that, you know, there's so many changes and that you won't sleep. It won't feel like a girls' weekend in Vegas. It won't feel like Miami with the turn up and the tequila. No, you are struggling. This is like Guantanamo Bay. Torture. And I was trying my best to just climb out of this cloud of unexpected misery. And one day, it took me 8 months, but luckily I had been seeing a therapist because my husband is white, and when you marry a white man, you get a therapist. It just comes together, right? Get the white husband, get the therapist, and a jar of mayonnaise. That is the package deal, right? So I had been seeing my therapist, and I walked in one day, and she was like, Angelina, you're not well. I'm gonna do something for you. I'm gonna suggest you go to a hospital and get treated. And I was like, when? Can I go right now? Like, the baby's fine. She's gonna be all right. She got plenty of milk in the fridge. Can I go now? And that was the beginning of my recovery. So I went into what I call an all-inclusive vacation to the Bahamas at the psych ward for 10 glorious days. And when I got better, I vowed that I owed it to every Black woman who makes it out. I owe it to every woman around the world who makes it out from under the cloud of postpartum depression and anxiety to reach back and make sure that they are better prepared than I was for the ripped vagina and the hemorrhoids and the stress, that they are ready and they feel prepared. So that is what brings me to this work. I bring my humor, I bring the real, and I bring help.
Yeah, love it. Love it.
Everyone, I'm really just first want to say I'm honored to be here and be a part of this important discussion and dynamic discussion as it's already becoming. So by background, my background is in public health. So I have my master's in public health from NYU, and I came to this work, I wouldn't say accidentally, because I became really outcomes kind of writ large. Black women were faring worse than all of them. And I felt very privileged to be sitting in this academic institution with access to these amazing journals and studies and becoming more heightened and aware of these problems that impact Black women. And I remember thinking, like, my God, like if I didn't choose this, this degree and didn't have the privilege of being in this institution, I don't think I would have been as aware of the risk of just being a Black woman in America and how that takes a toll on your health and your health outcomes. And you know, I started building Health Under Hue after, like, one day I came home, I was working full-time, grad school, and in grad school full-time, came home from work, was reading this paper, and again, just seeing the data, I started crying, reading a paper for class. And I remember thinking, if I'm so burdened by this problem, largely because I started thinking about my own life and my sister's life and my mom and my best friends, if I feel so burdened by this problem, I can't just sit with it. I need to do something. I need to build something that supports Black women and women of color with navigating a healthcare system that, quite frankly, was not designed for us. And so that is what brings me to this work.
Yes, yes. See, I told y'all it was going to be an amazing panel. Only a few minutes in. So you all touched on a lot of different things, and we know when it comes to maternal health, Black maternal health, there's a lot of different stakeholders. And so, Dr. Terry, I want to start off with asking you, in your capacity as a physician, what are some of the measures you've seen taken by the medical community, to work towards healthy births for Black women?
Are there any measures? I'm just joking. One of the things that I'm really encouraged by is this audience and that we're even having this conversation. I've been a physician for 21 years, and just having this conversation is very empowering to me because, as I mentioned, I found out in medical school in '94 about this problem, and I kind of thought, oh, okay, by the time I finish, you know, we won't have this problem anymore by the time I have my kids, and I was wrong. And so some of the things that have been very encouraging to me, I'll just start off with the implicit bias training that we've mentioned. I was able to partner with March of Dimes to do training for healthcare providers, and then extend that with Pampers to do that for the state of Louisiana. And that is really important because when you speak to providers one-on-one, people say, I want everybody to be better too. People say, I'm not racist. We're going to say the R word today. I hope that's okay. People say that, and I really would want everyone to understand that this is a systemic issue, 400 years in the making. I'm one person in an institution dealing with a system that's been 400 years in the making. And so for me, just having real conversations about how bias creeps into the room, patient to provider. Who do you see when you see me? What do you hear when I tell you I'm in pain? What do you determine about me when you decide I didn't take enough care of myself to warrant care? There's lots of data to show that persons of color are judged by providers, that when we meet providers, providers talk most of the time, providers talk down to persons of color. They're blamed for the circumstances that they're in. They lost their pregnancy because they didn't take care of themselves. Black women aren't the only people in this country who may have diabetes, may have hypertension, may have obesity, but we're the only persons who are losing our children at 3 to 4 times the rate and dying in pregnancy. So for me, it's encouraging to be able to have the conversations. The other thing that's encouraging is having real conversations about care models outside of our traditional models. Talking about birthing doulas, talking about lactation specialists, talking about having pregnancy model homes in the community. We have real data that shows when we ask the community, how can we best help you, that people actually get better. We have real data to show that when we see the person in front of us, the way we would want our mom, our wife, our sister to be seen, they actually get better. And so that's been very encouraging to me to see that the needle is moving, that we're talking about the Maternal Cares Act, that we have Momnibus, that one bill has already been passed. And so just working with colleagues every day who ask me, what do you think about this? Being in a space where I can be an upstander and say, hey, why did you say that? Why did you check that patient out to me that way? Can you tell me a little more about that? The last thing I'll say about being an upstander in this space and having people be receptive is I had something happen at work one day where a provider warned me about a family who was stressed about what had happened. It was a traumatic delivery, their baby was sick, mom had almost died. And they checked out to me, you need to be careful because his dad's a 50-cent type. And I said, what's a 50-cent type? And he said, he has muscles, he's bald, he has tattoos. I'm like, you just described my husband. Like, what is happening right here? And so what is happening right now? And just allowing women of color to have the space to be upset about a pregnancy experience that didn't go well in a way that we allow other families. To not call security because somebody's not happy that things didn't go well. To not tell somebody to calm down. No, you calm down. This is a bad situation. So in my 21-year plus career, I have been able to see spaces start to open up where we can have honest conversations, because nothing's going to get better if we can't have the conversation. And so for me, that's really, really encouraging. And I do believe that things will be better for my daughter and my son, although they don't want to get married or have children. So I don't think my husband and I have said it. They're like, we're good. So.
That's really good. And I think one of the things that kind of stood out as you were talking is just this idea of like sensitivity and cultural sensitivity, right? Like there's one path in terms of helping people kind of get there, right? And some people are further away from where they need to be than where they are. I think there's another element that I've heard a lot about in terms of like representation, right? And like diversifying healthcare providers or giving people access to diverse healthcare providers. And so, Ashley, I would love to hear more from you. You've started such a fantastic and much needed platform.
So women can go on there, they can search for a provider based on specialty, location, and also what insurances that doctor accepts. And not just doctors, but we have doulas, midwives, lactation consultants, therapists, all the types of different providers and practitioners that Black women and women of color are looking for. The second thing that we offer is a content library, because in the video talked about health literacy. As a public health person, I think that I believe half the battle is awareness and education and helping women understand how they can manage their own health and how they can advocate for better care with the provider that they have access to. So we have a content library that includes both articles and written content that supports women on a variety of different health conditions, as well as care journeys, prenatal care being one of them. And then the third component that we offer, or third offering, is community. And Dr. Terry, you kind of talked about leaning into community, listening to community, because that is healing in and of itself. And Dr. Melissa Harris Perry wrote an amazing article on in Elle magazine that was titled "How Squad Care Saved My Life." And it talks about moving beyond just self-care and the need for community support. And so we offer a community section of the platform where women can ask each other different questions. They can, like, I'm going through a preconception visit. What kind of questions should I ask my doctor? They're able to connect with other women as well as other providers. So that's what Health Interview offers today. And we're planning to build out telehealth consults, because there just aren't enough Black doctors around for everyone who wants to see one. And then I'll also add to that the onus shouldn't only be on Black doctors. We really want to support providers of all races and ethnicities to be able to provide that culturally inclusive inclusive care to women of color. And to go even deeper on prenatal support, we also have a product that's called Virtual Care Squads, largely inspired by that article from Dr. Melissa Harris Perry. And this offering, it combines both evidence-based, clinical and evidence-based health information, as well as peer support. So the curriculum, we actually have an OB-GYN writing the curriculum for our prenatal support care squad, and it combines evidence-based content as well as a community of women who are going through a similar care journey or experience, so that they're able to have both the evidence-based information as well as a community support to support them with their care journey. So that's what we're doing at Health and Review these days.
Love it, love it. Angelina, I'm going to bring it back to you. It's more of a broader question, and I would love to hear from you, given your experience with one of the most difficult parts of the motherhood journey, right? So given, you know, everything that you have seen and you've experienced, what do you think are some of the key issues of the Black maternal health crisis?
Oh, that's a loaded one. And Dr. T, please chime in if you feel the need, because I always tell people I'm a comedian. I don't know about the medical broad, nothing. However, I will say, I think a lack of education is, for me, what was a barrier. I just didn't know. And the more I interact with moms of all colors on social media, through my DMs, through Facebook, when I go on the road and do my comedy tour, what I hear is, oh my gosh, me too. I feel like it's the new Me Too movement, where moms feel like no one told them. They had the same learning curves that I had. They had all kinds of unexpected things happen, either during their pregnancies or postpartum. Some women had experienced, I had a perceived traumatic birth. We don't talk about that. My doctor never really educated me on what postpartum depression is, what postpartum anxiety is. It's the #1 complication to pregnancy, but no one, including my doctor, educated me about it. How is that possible? 3 in 5 Black women experience postpartum depression. You have a Black patient. Why aren't you educating me before my child gets here about what that could look like? So I think education is a huge issue for a lot of new mothers. I think that is the root of it all. If it's just on people's radar, and that I feel like they can take proactive steps to prevent this from happening, or managing the symptoms once they experience them. I also tell my moms and my community of people who come out to my shows, and you know, when I speak at corporate gigs, I always tell people, like, moms shouldn't be in crisis before they get the information. Like, why am I standing on my heels and you know what could happen around the corner, but no one's educating me on, not even my mom squad. Let's talk about that. The mom squad is acting like, oh my God, it's just so amazing. I love it. Oh, my baby, my boob, the milk. No, it sucks. You hate it right now, that's okay. But like, why aren't moms having these conversations with each other? Why aren't the older women in our families having these conversations with a young woman as she's encouraging her to get pregnant? So it's just education. Part of it is education on the onus of our providers who have the tools, but also I think that it's that peer-to-peer realness that we need to share with the women in our lives, especially if we've experienced it. We owe it to each other to share.
I just want to piggyback on something that Angelina is highlighting, because I think it's a mistake that a lot of people who attempt to be allies make when trying to empower women of color, is normalizing the stigmas around vulnerability for mental health. So for Black women, we have this Black girl magic. I'm strong. We're not invincible. We are not invincible. And we actually have great data to show that chronic stress, way before we ever start to have children, contributes to our poor birth outcomes. And so normalizing spaces so that we can say, hey, I do need help. I don't have to be strong all the time. Even in hospitals where we have resources, they'll say, oh, my mom's of color, they're just so strong. They're always so strong. They don't need any. Oh, they need something. They just didn't feel safe enough to ask for you. So I love Black girl magic. I love Black girl magic. When Black Panther came out, I was Wakanda forever, 24/7. But they didn't have high maternal mortality in Wakanda. Right. And until we can get there, we have to normalize these stigmas around mental health so people can say, hey, I need help. Yes. And part of being strong is knowing when you need help. Yes. For Black women too.
Yeah, I really love where you guys are taking the conversation, right? Like really talking about the importance of having conversations, especially the importance of forums like this. And so I'm gonna jump around a little bit. Angelina, I wanna pull you back into the conversation with this question. You've been so wonderfully candid about your experiences, right, with PPD. And I know that you're also currently working on a documentary film, which is fantastic. And so I would love to hear more about why it's so important for you to share. Why do you think it's important for you to share your experiences? And what do you hope your audience will gain from your story?
Yeah. Thank you for that. I know where my barriers were, right? And now that I'm on the other side, I'm healthy. My daughter's almost 7 years old. She's alive. I'm alive. Everybody's happy. You know, the stitches have healed. Right. We're good. Now that I know what my barriers were, I'm trying to improve. I'm starting there. I don't have the solutions. I don't have all of the money. I don't have all of the support. I know that I have a voice, and I know that moms and young women who are not yet moms need to know this information. So I'm starting there. I'm starting with what I have, which is a story, which is jokes, and I am a professional comedian and writer, so I decided to crowdfund and raise money for a documentary that includes humor, so that we don't scare young women. We don't scare people from having these conversations. People are afraid to talk about it because all they see are these images of women driving their kids into a lake, of, you know, psychosis. We don't have a mainstream vehicle of conversation to start this conversation about postpartum depression, anxiety, maternal mortality, maternal health. We don't have those tools. So I, as a comedian, as a content creator, am going to improve that. I'm gonna start there. So I raised $50,000 in 30 days to start this journey. Thank you. All on Instagram, Facebook, TikTok. What's up, TikTok? So that we can have a voice and the younger generation feels empowered. Like, yes, it's challenging, it's hard, but this is what success looks like. It's relatable, it's energetic, it's all the things. So that's what I'm working on with the documentary. I've also worked with lawmakers in California. That's the accidental activism part. I've started becoming a spokeswoman for an organization in California, working on legislation. We helped pass sweeping legislation across the state mandating screenings for moms during and after pregnancy. You can't believe the pushback we got from the insurance companies on this. And from even our state legislators who were women and mothers. But we pushed and we got it passed. We got laws passed to help educate our labor and delivery staff, all the nurses, the administrative staff, because what I learned with working with Cedars-Sinai Hospital in Los Angeles is that doctors sometimes don't screen because they don't have the resources and the tools to help mom once they realize that there's an issue. So we don't want that to be the reason why doctors aren't asking these hard questions or educating folks, is because then they have to do something that they don't know how to do. So that was the next component of the law. The third law was a referral system. Simple, a database of providers who offer services to support mom when there is an issue. So now I'm working across the board with federal legislators, namely the Momnibus Act and Congresswoman Lisa Blunt Rochester, Congresswoman Yvette Clarke, and working to federalize and standardize this level of care that we've achieved in California. This story needs to be told, and this work of us helping moms, reaching back. You know, in the documentary, I'll end on this, in the documentary, we reached a woman in Kentucky was in distress. She goes on TikTok, and she's holding her 2-week-old baby. She made an 11-second video pleading with strangers on TikTok for help. And she said, I just wish I knew about postpartum depression. I wish I had a friend. The way my inbox blew up, you would have thought I've gone to medical school with Dr. T. I was like, what am I supposed to do? I do jokes. You know, I survived the psych ward. Like, they're like, no, Angelina, maybe there's something you can do. Help her, help, exclamation, exclamation. I'm like, what am I supposed to help? So I was like, okay, fine, I'll reach out. I reached out to her. And again, I went to my Facebook fundraiser. I asked people for $5, $10, $20, what do you have? And within an hour, I had enough money to get on a plane to Kentucky to go help this woman. I found her a therapist with Postpartum Support International, one of my allies, found her therapist, and I found a charity to pay for 12 weeks of services for this woman so that she does not have to live with this. That's in the documentary. That kind of work.
Yeah, that's beautiful. You do a great job getting a lot of emotions. I mean, I'm crying, I'm laughing, but like, I think that type of work is so important, and I love the fact that you're documenting it and sharing it. And I think in our conversations today, we heard a lot of different kind of solutions and like potential paths forward to help, and between having like conversations and driving awareness of the issue. The other thing that we kind of touched on was the importance of representation. And so, Ashley, I have a question for you on that. We know that representation is key oftentimes in discussing these type of issues when we're seeing like racial disparity. Would love to hear you talk about the importance of women and children having caretakers who look like them.
Yes, I love talking about this, and I always give a caveat after I talk passionately about racial concordance. But Dr. Rachel Hardiman, who's based out of Minnesota, has done some really amazing research. And one of those studies showed that when a black infant is taken care of or delivered by a black physician, their mortality rate is reduced by 50%. By 50%. That same concordance wasn't shown to drive any, move the needle in terms of the mother's health, but 50% reduction in mortality for an infant just by being delivered by a black doctor. So that shows there's power and value in having a doctor who looks like you, and I won't get on my soapbox about the nuances and why that is. There was another study, I think based out in Oakland, that showed when black men were treated by a black physician that doctor took better notes, and those patients were more likely to listen to the physician and actually take on their medical advice and get the screenings that the doctor recommended. So that's why I wholeheartedly believe in my thesis with Health in Our Hue is that it's important for black patients to be able to find doctors who look like them, find providers who look like them, who understand their lived experiences, who understand the structural issues that are impacting their ability to access care, and the racism that they're dealing with that impacts their health and health outcomes. I can go on and on and on. And so there's a lot of value and power in that, and that's why I'm intentional about making Health in Our Hue the space that makes it easier for women to find those types of providers, if that's their preference. My caveat, though, is that the onus should not be on black physicians and black clinicians to provide quality and competent care to black women. It is a responsibility of everyone who's gone through medical school to be able to take care of every patient that walks inside their clinic. And we're, what we're trying to do, I don't believe that there's a one and done cultural competency training or one implicit bias training that's going to make someone magically competent. It has to be ongoing, intentional learning and staying abreast of the issues that disproportionately impacts patients of color. And so we're getting creative and working with other startups as well as existing training content, making it CME accredited so it incentivizes providers to actually want to engage with it, because we want to make sure that providers are being intentional about doing the work to make them the best type of provider for any patient that they see. And so I can go on and on, so I'm going to pause there.
Yeah, so I think there's this kind of, maybe not first step, but a step in making sure that you have a physician or provider that is culturally competent, right? And then with that then comes like the communication piece, huh? Like for them to actually be able to exercise that and work well with the patient. And so Dr. Terry, I would love for you, and I know this is like one of your passion areas, to talk more about the provider-patient relationship and how it positively or negatively affects maternal mortality.
Yeah, I'm really passionate about it. I don't know even how much time we have. We can come back for part two. I want to make sure, I want to just pick up on something Ashley said to lead into this question is, we're talking a lot about the biases and the perceptions that persons have. And sometimes when we're having these discussions, people have a view of what someone may look like if they have this bias. And I wanted everybody to know it looks like all of us, because we all have biases. And I want to talk about that this is a systemic issue. So with respect to physician-provider communication, everybody is mentioning medical school. So if you go back at the beginning of medical training in the US and you look in those textbooks actually say that persons of color were inferior. Their brains were smaller, our skin is thicker, we tolerate pain better, so we don't need as much pain medicine. A survey of medical students just 5 years ago, they said the same thing. They thought the skin of black patients was thicker, so we tolerate pain better. So just translate that to a mom who's pregnant, who's in preterm labor, maybe even abrupting, about to lose her pregnancy. It's not that someone's looking at them saying, oh, your skin is thicker, I don't think you have pain. But if you are living in the United States, these messages are embedded systemically through all the messages. I mean, I got compliments on my hair today. I finally can wear my hair natural. But America doesn't tell me that my hair is okay. It doesn't tell me that my Afro puffs are okay. It doesn't tell me that my skin is okay. It doesn't tell me that my lips are okay. We have evolved to that. So these messages are subliminal. So at the bedside, I'm in the hospital at the bedside every day, trying to be an upstander for the way patients are viewed and making sure we keep their humanity. And I want to make sure that everyone knows we're talking about racism, not race, because it's not, you're not born and automatically going to have these poor outcomes. So today in the United States, your zip code actually is a better predictor of how long you're going to live. My friends, that's the definition of a disparity. If you tell me your zip code right now, I could pull it up and tell you when you're most likely to die. America is still very largely segregated. So for me, at the bedside, I want to be an upstander. I work with colleagues who want to be upstanders as well. I try to normalize the conversations that are happening around patients, and I try to make sure we're following the standards of care. Because for black women who are dying, 2/3 of those deaths are preventable. And it's not because the hospital didn't have standards. It's because somebody came into that hospital and somebody decided that in this case, we can deviate. And that's just not okay. So what's important to me with respect to provider-patient communication is we start with the humanity and not the disease. This is a person with hypertension. This is a person who's lost 3 babies. They're going to lose 1 more. This is somebody who didn't get prenatal care. Just recognize that the lived experience of being a black and brown person in the United States, the lived experience predates everything before I ever walk into your office. And if we could just remember that the social determinants of health, where we live, work, play, worship, and find meaning, impacts. Trust that I do want to get to the appointment. Understand how hard it is for me to get to that appointment. Trust that I want to call you if I can't make it. Understand that I may have had barriers that didn't allow me to make that call. Trust that because you had a family meeting at 3, I couldn't make the family meeting at 3 because I got other stuff going on. I literally asked someone a couple of weeks ago at work, have you ever been through anything? I mean, just like anything in your life, like just anything. So if we could just have the humanity, I believe, and recognize our patients are partners. I'm not here to tell you what to do, but I am here to partner with you so that you find out what's the best path for you. And in order to do that, we have to, like Ashley said, have health literacy for our Black and brown patients. If somebody says they're Spanish speaking only, well, why are you in here still trying to talk English? Because they're not in their head. Like, that don't make no sense. I mean, we wouldn't do that for anybody else, but we do it for Black and brown patients. Oh, they never have any questions because they don't know what you're saying. So we have to start with the humanity, and I do believe that the field of medicine is, and people are saying we finally see it with COVID, but we had a lot of information prior to the pandemic. We had a lot of information prior to the pandemic. So if one thing came out of the pandemic is we finally realized, okay, this has got to get better. So starting with the humanity, recognize that there are standards of care. We don't want to have equal care. It's not equal, it's equitable, because I may need something different to get to the same outcome. And that's all we want, the same chance to have a normal pregnancy. And one more thing, we want to have the chance to be happy about our pregnancy. Yes. Like she said, all the pictures. I mean, we want to have joy. You don't want to go through your whole pregnancy like, oh my gosh, I'm not going to survive my pregnancy. My kid's not going to survive it. Even if they do, I have to raise this child here. It's the lived experience. So race, not racism, and humanity over the disease process. Recognize that they have a lived experience that brought them in front of you, and how can we help them?
That's good. Yeah. Drop the mic, drop the mic, drop the mic, drop the mic. Oh. Drop the mic.
Do we have time for one more question, or one more? Okay. Wow, I have a lot of good questions on here, but I'm gonna jump down to the end. You guys have an amazing captive audience here today. What do you, and this is for like you all answer, right? What do you all want to tell them about where to go from here? What can they do to continue to engage in their own communities on Black maternal health? Like, in other words, like, how can they help? Whoever wants to start could start.
Well, this is a policy wonk in me, but one thing that I believe will really move the needle with supporting and moving the needle on Black maternal mortality is expansion of Medicaid coverage, especially for postpartum support. So election season, as you're choosing your legislators, policymakers, be intentional about really understanding what they care about and where they stand on certain issues.
I would like to offer, you know, one great way to partner, I think, is to partner with organizations like Health in Her Hue, like the Postpartum Revolution. It's to partner alongside grassroots organizers, providers like us, who have our hand on the temperature gauge on what is needed in the Black maternal community. You know, a lot of companies, corporations, they don't know where to start. And this is why I appreciate the opportunity to be here at Vital Voices, because we're in a room full of movers and shakers, and Ashley and I are doing the work. Dr. T, you are also, but you got the establishment, you know. Yeah, me and Ashley out here like, come on, y'all, sign up for the telehealth, come on, you know. Postpartum revolution out here. $5, $10. Who got $5, $10? Let's go. Right. But we are here doing the work, doing the maternity, thank you. We're out here giving out Pampers. At my shows, when I go on the road, my Postpartum Revolution tour, we have a 40-foot pink bus. And I call it the Jehovah's Witness of postpartum depression. I literally go door to, hey, everybody okay in there? Literally door to door, providing education, providing diapers, providing therapy support for that mama in Kentucky. Literally checking on women, educating women, allowing them to laugh through the pain, connecting them to doulas, midwives, providers, therapists. I encourage women, get your therapist before you get pregnant, girl. Get your therapist. Because you don't know what kind of support you're gonna need. You gotta set up your, what I call postpartum busters before you have your baby. Who you gonna call? Postpartum busters, that's right. Get your therapist, your lactation consultant, your midwife, your doula, your postpartum doula, your meal train. Get that set up before your baby's here so you get care. So that's a way that people can engage, is engage with grassroots organizers like Ashley and I, who've started, and we have our hand on the pulse. We know where the needs are, and we have the built-in infrastructure and the fan base to really plug in. All we just need is some backing, is the help. Help us. Thank you.
I think this is the first time I've ever been told I'm part of the establishment. I'm like trying to process how.
Dr. Terry, Health & Hughes venture back, so we part of the establishment.
Oh, okay.
I'm not. I'm not.
I'm like, let me go get on a pink bus and get my life together. I just want to say two things. I want to echo, so there are several days a week I do work with the establishment. However, because of what I see in the establishment, that is what drove me out of the hospital. And my first role in advocacy was with March of Dimes, actually doing training in the black churches and HBCUs. Shout out to Prairie View, A&M. But I firmly believe that if we just go to the community and ask them, how can we best help you? By bringing in the community leaders, do a forum, do a focus group. There are a lot of people concerned about this problem, a lot of committed people. They throw a lot of money, and then they open the doors like, why won't they come to our program? Well, did you ask them if they wanted that? We need to have the community at the table. And for policy, I just want to echo what Ashley said about postpartum coverage. We talked a lot about maternal mortality. Most of those deaths happen in the first 3 months after the delivery, but up to a year. And I also want to put in a plug for paid family leave. The United States, we are the only developed country. We're the only developed country. Did y'all hear me? Only developed country that does not have paid family leave. But we want to say we support the family. We want to say we care about the family. That it's just not okay. And the countries that do have paid family leave have better outcomes. Healthy babies come from healthy mothers who come from healthy families who come from healthy communities. So if our community is not healthy, we cannot expect downstream to have a different outcome. Thank you.
No time for Q&A? No. Well, sorry, you guys, but I hope we delivered on the goal that we established, right? To leave here better informed, rejuvenated, excited to do work. You have two fantastic organizations that you've gotten familiar with to support. And I just want to thank our fantastic panelists. If you guys can give them a round of applause. Ashley, Angelina, Dr. Terry, and yes, and Vital Voices for having us, and Pampers and P&G. Shout out to my company. Thank you all.